Welcome to SVG-TV News for Monday, January 3rd, 2022. I am Rochelle Batiste with the details. Students and teachers across the country returned to school today for face-to-face learning after more than a year of online classes. Our news team spoke with some parents who were happy for the resumption of the face-to-face classes.
We're hoping for the opening for a very long time because I know it's very hard for the parents at home, because when parents have to be at home looking after them when on the online class, you have to really monitor them. You cannot leave, and then parents have their work to do, and those who have to go to work and have no one, and the children unattended, is like you don't know what they're doing.
I have youth at school. I have youth at college, I have youth at secondary school, and I have youth at primary school. I mean, we know that the online thing definitely wasn't working. Some of the youth and them way behind. Some of the youth and them who was coming like first, second, third right now, them, you know what I mean, them not really, you know. So me give thanks that the youth and them come back to school still and them could, you know what I mean. Because I was pushing them a little back, so I hope that they could be, you know, up to date with their medication now, you know.
The parents said there were many challenges with online classes which were not as effective as face-to-face classes.
I just be right there with my grandchildren them and have to be monitoring them, because if you give them a little chance, it's like they're online but they're gone on something else. So I think it's a very good thing so that the school could be reopened, that they can have face-to-face and the children might be more positive and take their education more serious, because the online is very good for some children, but not for some. Because some of the children are, you know, who love the computer and the other things and who really interested in their education. When you don't, you know, sometimes you don't have to push children.
It's better they going to school because the youth and them done so the internet thing now. You understand? And them not paying no attention, nothing. It's not hands-on. So now they come back to school, it's more hands-on. And I speak to some of the teachers and they're telling me that some of the youth and them, they're behind. You understand? They can't spell properly, they can't do anything properly. I talked to the next teacher, they tell me now he just found out that like one of the parents was like doing the work for the kid. So now the child come back to school and they ask him the same question. He don't know anything. He don't know how to read, he don't know how to write, he don't know anything. So unfortunately, the internet thing is not really working.
Meanwhile, a number of students were excited to be back in school for various reasons.
Looking forward to learning more and get good in my studies.
For the first day of today, it was excellent. I got to beat back all my friends from class and stuff, interacting with them. But my main focus of coming here is to get level 2 certificates and after start my own business.
I feel very happy because I get to see my friends again and finish the work that I have started in term 1.
It's pretty exciting to meet back with my colleagues and my teacher and to actually do practicals, because we haven't started practicals as yet. The course that I'm doing is commercial food preparation and I'm just excited.
At one institution, a principal mentioned off camera that it is unfortunate that some good teachers are no longer with the institution due to them not being vaccinated. Under the statutory rules and order number 28 of 2021, all frontline workers, including teachers, were expected to get vaccinated to stay on the job. The Ministry of Education had earlier indicated that the safe reopening of schools is subjected to adjustments based on the evolving COVID-19 situation. And 141 new COVID-19 cases and 2 deaths were recorded here between Tuesday, December 28 and Friday, December 31st, 2021. The 2 deaths recorded included a 71-year-old female who tested positive for COVID-19 on Christmas Day, December 25th, 2021, and was admitted to the isolation ward at the Milton Cato Memorial Hospital and died on December 28th of COVID-19 pneumonia. The other deceased was a 75-year-old male who tested positive for COVID-19 on December 28th and was found dead at home on December 29th, 2021 of COVID-19 pneumonia. Both patients were unvaccinated. Their deaths bring the country's death toll from COVID-19 to 83. No patient has been admitted for COVID-19 at the Argyle Isolation Facility. However, 10 were admitted to the COVID-19 ward at the Milton Cater Memorial Hospital, 2 of whom are vaccinated and 8 are unvaccinated. 98 recoveries were noted over the reporting period. 582 cases are currently active and 83 persons with COVID-19 have died. 5,991 cases of COVID-19 and 5,326 recoveries have been recorded in St. Vincent and Grenadines since March 2020. And Health Promotions Officer in the Ministry of Health, Wellness and the Environment, Shanika John, said everyone has an individual responsibility to help prevent the spread of COVID-19 and the more transmissible Omicron variant. She was speaking on NBC Radio, in which she encouraged those who have already taken 2 doses of the COVID-19 vaccine to get a booster shot within the specific time period, and those who are yet to be vaccinated to take the jab.
We've been a year and a half, we've been going with it, we've been encouraging people to take the vaccine, we've been talking about all the precautionary measures. Even with the reopening of schools, the measures are not going to change. They just need to be enforced and tightened as much as possible. So keep your distance, wash your hands, wear your face mask properly, and get vaccinated. And if you do decide to have an activity, a gathering, make sure that you are actually limited. Because I've always said to persons, it's not just about you and I having an activity and gathering, it's the ripple effect. Because I go home to my family, then I go to my workplace, then I may go to my church environment, and then I might go to the gym. So you have to consider all of those steps that you're going to make, and the fact that you have been exposed or could expose yourself, then you're ultimately taking it around like that. So we need people to keep their bubbles tight. And if you're not feeling well, get tested. And as I would say, hold your corner, Johnny. Hold your corner and hold it good until...
Jaheim Shilling Belgraves of Rose Place is now in police custody after a wanted person bulletin was issued for him last Friday. The bulletin said investigations are being carried out into several reports of burglary in which Belgraves is a person of interest. Meanwhile, SVG-TV News understands that the 35-year-old security guard who was arrested in connection with a pornographic video involving a young child was sentenced to 4 years behind bars on 2 counts of indecent assault. The resident of Mesopotamia, originally from Sign Hill, appeared before the family court today and reportedly pleaded guilty to 1 count of indecent assault. Many Vincentians are happy that 2021 is now in the past and are looking forward to a better year for 2022. SVG faced many challenges in 2021, such as a dengue fever outbreak, the COVID-19 pandemic, and the eruption of La Soufrière volcano, which disrupted many lives. Our news team spoke with some Vincentians today who said that it was a tough year, but they are thankful they survived it all.
The corona virus keep down a lot of things. So glad if it could cool down that we could do a little better. Yeah, for the new year coming. I hope and trust that God will able to. God is the healer for everything. And he will everything rough, he can make it smooth. So I hope the corona will able to go down and let everything get back together. Especially the school children, like them to stay in school that they could be able to learn the lesson. Because without education these days nothing doing.
Well, 2021 was a terrible year, and we're out of it, and we reach into a new year. We thank God that we reach into a new year, and I hope God will bring good things to us for the new year. Well, I ain't planned for anything, but wherever God provides for me for the new year, I will thank Him and I will satisfy Him.
There are some whose expectations for 2022 is not so positive, but they remain optimistic that there is a bright future for SVG.
I'm thankful to God for life. For me, I pursue righteousness. What I want out of life is actually righteousness, because that's the only ticket that that I have been told that I can use to move out of this world. So for me, living is to live for God and to perfect my character through, the blood of Christ and His help. And for me, that's the most meaningful thing in life.
I don't see nothing on the horizon that things gonna improve. I get even better. But we still have to be in expectation. I have to have some hope still, because you don't know what is unseen and behind the corner. But
up to Christ, I don't do nothing, I don't walk in, I don't lose to help me. I should have to hold, I should train them to send to school. But it's giving God thanks. Well, if your son give me a satisfy and thank God, and after God, I she.
And 3 babies were delivered at the Milton Cato Memorial Hospital on New Year's Day to mothers who are all from North Windward in the red zone. Hospital administrator Grace Walters said that they were normal deliveries and the babies and their mothers are healthy, noting that one baby weighed more than 8 pounds.
Our first baby was born to Utila Byron of Georgetown at 4:15 p.m. This was a male baby weighing 3.44 kilograms. Our second baby was born to Kiwana May of Overland. Kiwana had a female baby at 9:32 p.m. weighing 4.37 kilograms. And our third baby was born to Nisha Peters of Sandy Bay at 11:14 p.m. Nisha had a female baby weighing 3.2 kilograms. All babies and mummies are doing well.
The hospital administrator said 2 of the mothers have already been discharged except one, and that they were pampered for delivering their newborns on New Year's Day.
Doing anything for them special?
We have we have different persons who have indicated that they will be donating to the mummies. And fortunately for one of them, they are still on the ward, so that person is easy to get to. So later on today, somebody may be donating to that person. Other than that, the hospital, we usually donate to the last person who delivers for the old year, and because most of the time donors come forward to donate to the first baby. So the hospital would usually donate to the last baby, but if we do not have donors, then we usually do our own little celebration.